Your patient was admitted last night with intractable nausea and vomiting post-chemotherapy that day. It's time to take care of her. Morning assessment and medication time. You introduce yourself to the patient and notice the blue chemo caution card, which reminds you there are special precautions you must take when caring for a patient who is receiving chemo. What do you need to know? What is the policy and how do you find it? The policy is on the portal under Policies and Procedures, under Pharmacy, and is called Hazardous Drug Handling. This policy is comprehensive, covering pharmacy preparation of hazardous drugs, including chemotherapy, nursing administration of chemo, caring for that patient who has received chemo, and environmental services responsibilities for the safe cleanup and disposal of material exposed to chemotherapy or hazardous drugs. Let's see what the policy says about caring for the patient who has received or is receiving chemotherapy. A blue card should be placed at the head of the bed for a patient receiving chemotherapy, and up to 48 hours after the last dose. No protective equipment is needed for ordinary care of patient, unless dealing with drug administration or bodily waste. Persons dealing with blood, vomitus, or excreta from patient should wear purple nitrile gloves and vapor barrier gown, and toss when removed in yellow chemo trace waste bucket. Wash hands thoroughly with soap and water after removing gloves or gowns. Linen can be dealt with normally. All RRMC linen is considered contaminated. If linen is heavily contaminated with patient's bodily fluid, then it should be thrown away in a yellow chemo trace bucket. Why do these procedures need to be followed for 48 hours after the last chemo dose? Many chemotherapy drugs are considered hazardous to healthy people. Chemotherapy drugs can be dangerous to others in these ways. They can cause abnormal changes in DNA. They may be able to alter development of a fetus or embryo, leading to birth defects. They may be able to cause another type of cancer. Some may cause skin irritation or damage. Caregivers who care for patients who have received chemotherapy must take precautions to avoid direct contact with the drugs and when they handle vomitus, urine, and stool for a few days after treatment, because body waste may contain the drugs. It takes about 48 hours for the body to break down and/or get rid of most chemo drugs. Caregivers should wear special purple nitrile gloves and vapor barrier gowns, which have been specifically tested to be impervious to chemotherapy agents when handling chemotherapy agents or body waste from a patient who has received a chemotherapy agent. The caregiver should dispose of the special gloves and gowns in a yellow trace hazardous drug waste bucket. The caregiver should then wash hands thoroughly with warm water and soap after removing protective gear. Danielle's next patient is Aurelie, who is getting an oral chemotherapy drug. Let's look at the policy now for how to give oral chemotherapy. A blue chemo card should be placed at the head of the patient's bed. A nurse should wear purple nitrile gloves when administering an oral chemo. Do not touch the drug with bare hands. Check the drug while still in the transport bag to make sure it is intact. If the med is intact, administer to the patient. Once the patient has taken the drug, place all materials contaminated by the chemo drug back into the transport bag and discard in the yellow trace hazardous drug waste bucket. Remove gloves and discard in the yellow trace hazardous drug waste bucket. Wash hands thoroughly with warm water and soap. To recap, purple nitrile gloves must be worn when touching and/or administering a chemotherapeutic agent, because tablets or capsules may be coated with a dust or residual hazardous drug that could be inhaled, absorbed through the skin, ingested, or spread to other locations. Liquid formulations may be aerosolized or spilled. Crushing, splitting of tablets, or compounding of oral cytotoxic drugs may be done only in the Biological Safety Cabinet in FCC. If a chemomed gets dropped on the floor, the nurse needs to return it to the transport bag and send it back to the pharmacy for disposal. The actual chemomed is a black bucket hazardous waste item. The nurse can decontaminate the floor where the med fell with a bleach wipe or can call environmental services to clean the floor. The OR does a procedure using mitomycin. The drug is instilled into the bladder to treat bladder tumors. It is important to remember, confine and contain the chemotherapeutic drug and trash contaminated with the drug. We need to remember the irrigant may leak out of the bladder, so have something like a chucks under the patient to prevent spread and contamination of linens. Any chemo irrigant that leaks onto a surface should be treated as a chemo spill. The spill kit should be utilized for cleanup. Material used from the spill kit should be disposed of in yellow trace waste buckets. Material used for a large spill, greater than 30 milliliters, should be disposed of in a black hazardous waste bucket, and the product and quantity documented on the black hazardous waste disposal log. These can be obtained from the FCC pharmacy if needed. Environmental Services Department has the responsibility to collect both the yellow trace waste buckets and the black hazardous waste buckets. Disposable gloves and goggles and/or face shields are to be worn while handling any cytotoxic and/or hazardous waste. The collection waste will be transported in closed carts to the trash shed and/or trailer. EVS is responsible for the disposal of cytotoxic or hazardous waste following established operating procedures. Cytotoxic and hazardous waste will be stored in the trailer for disposal by incineration off-site. We hope this helps clarify the role of the nurse and/or caregiver in handling cytotoxic and hazardous drugs. If you have any further questions, don't hesitate to contact the pharmacist in the Foley Cancer Center.